The armamentarium for the STC is going to be your universal curette, make sure that it's really sharp, your periodontal probe, your cotton tip applicator, and some wet gauze. Begin by verbalizing the treatment to the patient. So I'll ask the patient, Mr. Typodont, I'm going to be performing something called soft tissue curettage. I'm going to be removing the diseased inflamed tissue and also promote tissue growth. May I go ahead and proceed? Mr. Typodont will respond and say yes, and then I will go ahead and start the procedure. So I'm going to be demonstrating the STC on the buccal and lingual surfaces. I have my probe. First thing you're going to want to do is probe from the distal line angle to the mesial line angle. Then you're going to want to use a cotton tip applicator in your non-dominant hand and your universal curette, making sure that it's very, very sharp. We'll select the correct end. You're going to place the cotton tip applicator just below the gingival margin. And then you'll insert the tip of your UC apically, pointing down towards the junctional epithelium. Then you will open up the blade to 45, and you will do one continuous stroke from the distal line angle, applying moderate pressure to the mesial line angle. Then you will use your wet gauze to remove any debris or tissue tags. So you're going to do the lingual surface. So first you're going to want to probe from distal line angle to mesial line angle. Then you will take your cotton tip applicator and your non-dominant, place it just below the gingival margin. You're going to use a cross-arch fulcrum. We'll insert the instrument, the distal line angle at the blade close, slightly angle outwards, one continuous stroke from distal line angle to mesial line angle, then removing any residue and tissues. So now I will demonstrate STC on the interproximals. For the mesial, you're going to start probing from the mesial line angle to the mesial interproximal. Then you will get the correct end of your UC. Place this at the mesial line angle, pointing apically. The blade closed. To open the blade, you will drop the handle slightly, and then you will do one continuous stroke, pressing on the papilla going towards the adjacent tooth. For distal interproximal, you will probe from the distal line angle into the distal interproximal, and grab our UC, insert the tip. The blade is closed. To open the blade, we're going to stand up on our fulcrum. Then we will do one continuous stroke, pressing against the papilla, going towards the adjacent tooth. Then you will use your wet gauze to wipe away the interproximal tissue tags. Next, we will do the marginal gingival on the buccal surface. So we will be grabbing our UC, and we are going to direct the tip at the distal line angle, the blade closed. To open the blade, we will bring our handle instrument towards us because we're on the buccal surface. If we were on the lingual, we would put it away from us until your terminal shank is parallel to the occlusal plane. You're going to do one continuous stroke from the distal line angle to the mesial line angle with slight pressure. And then you will use your wet gauze to wipe the area and any residual tissue or bleeding. So once the procedure is complete, I will verbalize the post-op instructions to my patient. So I will say, Mr. Typodont, the procedures are completed. You might be numb from the local anesthesia, so try not to chew around the tissues while they're still numb. If you do experience any pain or discomfort, you can take Tylenol or Advil, but please do not take aspirin because it can prolong the bleeding. And with that, some bleeding will be normal, but if it's excessive, please call the dentist right away. Do not use any straws and only eat soft foods without a lot of strong spices, flavoring. And I would like you to maintain good oral hygiene in the untreated areas, and then the areas that we worked on, just don't floss those areas, but do gently brush them like you normally would. So the day of the procedure, do not do any mouth rinses, but the days following treatment, you can do a saltwater rinse. So you'll mix half a teaspoon of salt in a half a cup of warm water, not too hot. And you can use this every 2 to 3 days to help with the swelling. And you pretty much do this until the tissues are fully healed.